So welcome, Dr. Lucas. It's an honor to have you. You've studied psychoanalysis for many, many years.
Yes.
And you've trained many people in psychoanalysis through the Institute for Modern Psychoanalysis and now through the School for Training in Effective Psychoanalysis.
That's right.
And I think my first question would be, how did it all start?
Well, what part of it are you interested in?
Okay, your interest in psychoanalysis.
Oh, well, I studied a number of things first, and then I met Hаймон Спотниц, and Dr. Хаймон Спотниц thought that I should study modern psychoanalysis, or psychoanalysis anyway, and I took a course with him at NYU after and I got acquainted with him then, and I found him to be a most unusual person. I found him to be absolutely different than any previous teacher that I had ever had before. He was, he never caused a person in his class any anxiety or criticism. He never gave them any criticism. It didn't do anything of a negative nature to anybody who was in his class. I found so many of the teachers were difficult to learn from, even though I was interested in learning from many of them. And I found that on several occasions, especially when I was taking a course at NYU in psychology, I found that people argued with things that I said, and I pointed out to them at that time that what I was saying was absolutely correct, and they were not, and they got annoyed that I should point these things out to them. But Hаймон Спотниц was not like that, so that was a very unusual experience for me, and I wanted to be as much capable of being beneficial to future students that I might have as he was with me. That was a very important purpose that I had in mind. And sure enough, when I was brought into a new school situation with him, he brought me along, and I found that using what I had learned from him as far as being beneficial to my students, I found that my students enjoyed learning with me. They progressed very rapidly as a result of the learning methods that I was taught by him. And I continued to work in that vein for quite a while, even afterwards when I left the first school that he brought me to, and I taught there for several years as a member of the staff. Later on, I went and taught in another school, and again, the students liked my way of teaching very much, and because I found that his method was the best method I had studied.
Yes, what was his method that you learned that was the best?
Well, his method was never to find fault with a student. If there was some problem that a student had with him in any way, he would investigate it with them and find out what their objection was to what he was saying, and he would try to find out where they got their attitude and approach, And he had one student in there who was very, very antagonistic, but he managed eventually to get him to talk in a different way in that classroom with him for the whole semester finally. And I was able to trace this person's program afterwards when he taught in a different place, and I found out that he was teaching quite differently. He went back to his old method because he had been educated in a more accusatory and dictatorial approach. So I found that if you want to help people to learn the best possible way, the methods of being gentle, considerate, and investigatory with a difficult patient in the school was to investigate what their problem was with yourself as a teacher, primarily. And that seemed to me to work very, very well.
So would you say that that's a primary principle that you go with in your work with your patients, is to investigate?
Yes, I work with my patients to the best of my ability in exactly that way. Now, it's true that occasionally you get some obnoxious person in your classroom, but if you keep working with them in the way in which I was taught and the way in which I continue to work, I find that sooner or later the person begins to want to behave and be treated the way I was taught to treat people, as being the teacher and them being the student. And wherever I worked, and I've taught in a number of different places under certain circumstances, and it always worked out very nicely for me.
So it sounds like Dr. Spotnic had a lot of respect for people.
Yes, he did. He had a lot of respect for people, and he didn't see that there was any benefit in being damaging to anybody, criticizing them or denigrating them. And I saw him do that down in Texas on where he actually worked with a gigantic population, and he handled them all superbly, and I used that as my method as well. Yes.
So in your teaching of students here, you've been doing that for many, many years.
Yes,
first
I have
through the Institute for Modern Psychoanalysis.
Right. Yes, exactly. Mm-hmm.
So what was special about your program, what would you say?
Well, I don't think my program was special. People wanted to learn how to work with patients, and my job was to help them learn what they wanted to teach, and to teach it in the same beneficial way toward the patients. If the patients were treated gently and with due respect, and by investigating what their handicaps were, then they became more capable of working with patients. And I think that that's a very good way of working. Yes.
And I've enjoyed my training with you for many, many years. So I wanted to say that.
Thank you for recognizing that. If you find any method that has more benefits in it, I would like to learn from you as well.
Oh, thank you very much.